International Journal of Health Policy and Management. Quality and speed are our culture and the keys to our success. Welcome to the audio summary section of the International Journal of Health Policy and Management.
Policies and practices outside of the health sector in domains like education, transportation, and housing all mediate the effectiveness of health policy and our health interventions. As such, for decades, we've encouraged policymakers to consider the health implications of their policies and practices, an approach that we often refer to as health in all policies or healthy public policy. Central to these initiatives is a recognition that disparities in social conditions can in turn create, exacerbate, or sustain disparities in health between population groups. Where health disparities are caused by social disparities that we consider to be unjust or unfair, what we deem social injustices, then we term these health disparities health inequities. Health inequities, of course, and the reduction of health inequities have been placed at the top of public health agendas all around the world. Now, given this important social and health policy nexus and the importance of intersectoral collaboration if we're going to address health inequities, increasingly we're seeing the development and implementation of intersectoral action on health inequities. Yet, arguably, and what we argue in this paper, is that intersectoral strategies for health equity, by their very nature, might actually limit the degree to which other sectors might actually collaborate on this health aim. This is because intersectoral action on health equity actually privileges the pursuit of equity in health over equity in other sectors or for other social goods. Now, this is trivially true because we're talking about intersectoral action on health equity and not intersectoral action on education equity or, say, on social equity, which might look at equity across different sectors or different social goods. So this should be considered problematic because the health sector's pursuit of health equity might actually be at odds with the pursuit of equity in other sectors or for other social goods. So to sort of demonstrate why this might be the case, take the example of the education sector. So the education sector takes as one of its principal concerns the pursuit of education equity. Education equity might mean a lot of different things in the education sector, and we might want to learn what that looks like and how that might align with how we conceptualize of equity in the health sector. So for instance, a key component of education equity might be school choice. So people will disagree about whether this ought to be the case, but some might argue that parental choice, the ability of parents to choose where their child goes to school, whether it's in a public system or a private system or charter school, so forth, actually represents a key principle or understanding of education equity. And given what we know between the correlation between education outcomes, education performance, and health outcomes, we might, from a health equity perspective, see differences arising between which education systems children are in, and whether that produces disparities in health outcomes. From a health equity perspective, if we do see those disparities, we might think that this is problematic and want to intervene in the education sector to redress those disparities. The education sector, on the other hand, might say, well, this is important for our pursuit of education equity, and so pursuing that health equity aim might actually undermine what we're trying to achieve in the education sector. On the other hand, there's certainly going to be instances where policies and practices in other sectors, like the education sector, align with what we're after in terms of health equity. So for instance, addressing discriminatory behavior or systemic discrimination in education will likely always produce or align with our pursuit of health equity. So there's areas where there's going to be congruence about how we understand equity between health and other sectors, and areas where there might be dissonance between how we understand equity in the health sector and other sectors. So we argue what needs to be done is ground these intersectoral strategies in a theoretical way that can sort of account for the different ways we might pursue equity for different social groups, or social goods, such that the pursuit of equity in one sector doesn't undermine the pursuit of equity in another sector, or at least we can understand the equity trade-offs that might be going on here and take account of that. One way to do this is to ground our intersectoral action on health equity in theories of social justice. Theories of social justice aren't privileging health justice or education justice or environmental justice or economic justice per se. They're looking at how justice ought to be pursued socially across different sectors. And so if we can ground our thinking about the intersectoral pursuit of health equity in a theory of social justice, we might start to think through the ways that equity in health can be achieved in other sectors without undermining their pursuit of equity for their social goods that they're responsible for in those sectors.